restart sometimes uh, when we have days like today and I start my live stream and there's no audio. I'm going to double check the settings because last time I did this, yep, sure enough, we're not going through the TV. Hey guys, I'm recording the podcast today live and I did not announce this on social media. So if you hop on and could go onto our networks and just let folks know that we're live, that would be great. And today I am going to talk about how we can fund medical care in our communities. But it's a Monday podcast, so I have like all of the normal segments, and we're just going to get started with that. I will do a 5-second pause like the old days because I got distracted because my phone text message alert went off right as we were going live. That's right. Anyway, so we are going to record that live. I'll do a 5-second break and then hop in. If you have things you want me to see, definitely put the first few words in all caps. I see a couple of you have joined now. If you are on my social networks, please let folks know we're live. Looks like the YouTube notice actually worked. Woohoo! Sometimes it works, sometimes it doesn't work. Anyway, you ready to go? We're going to do this. 5-second break and then we go. Welcome to Living Free in Tennessee, where we talk about building the life you choose on your terms. Today is Monday, March 20th, 2023, and this is episode 715 of Living Free in Tennessee, and it's a Monday episode, so we have a bunch of segments before we get into the meat of the discussion, and I'm doing this live without having announced it was going to be live, so we'll see whoever's here. If you have thoughts along the way you want me to see as we dive into the spitballing part of this, put your thoughts in all caps and I will star them and probably wait till the end to answer because once I'm on a roll, I'm on a roll. But if one fits in and I see it, then I will build it right into the meat of the podcast. I'm going to toss around some ideas for how we can fund medical care in our communities without taxes. And I think this is important because one of the big fears people have about how can society work without taxes or how can society work if we don't have the current system we have now is they get sick. They don't have anything in place to backstop them. Insurance goes away and the costs of getting sick are super high. So they lose everything. This happens now, guys. This happens now where your insurance doesn't cover you all the way. And people will lose their homes to a cancer diagnosis, for example. So my thought is, how can we do that better without government intervention, without taxes? And we may even get into a little bit about what's stopping us now. But I think it's important to have these sort of how can we discussions because the world could work better. And a lot of times critiques of ideas like agorism, which are valid. People are wrapping their heads around it and they're like, but how would you cover people who need medical care? I'm like, well, how are we covering them now? And how's that going for us? Not too well, actually. So can we do better through voluntary interaction? It's a good question. It's a hard question. Before we jump into that, though, I want to talk about our featured event of the podcast. And this one is not a single event. It's a bunch of different events in Dixon, Tennessee. And they're being put on by Dawn Gorham of the Gorham Homestead. She's doing a bunch of workshops from how to can to a whole bunch of other really handy homestead things. And that's over at thegorhamhomestead.com. I have the link in the show notes. Go check those out if you are in Tennessee, and you can then see what Dawn has to offer and maybe sign up for one. Like the canning workshop's about $125. You're there for 6 hours. She feeds you. Looks like a great not webinar, but workshop to go learn some actual skills. Also wanted to thank today's sponsor of the show. That is the Self-Reliance Festival digital passes. The Self-Reliance Festival brings together homesteaders, preppers, people who just want to take ownership over their lives. And we do it in Camden, Tennessee. March 25th and 26th is our next one. If you cannot get out there, though, we have digital passes. We'll be live streaming many of the sessions. We'll be recording as many as we can, depending, it's like some speakers decide they don't want us to, but most of them say yes. And then all of that gets packaged into the digital pass. If you want to be there for the live stream, those tickets are available at selfreliancefestival.com. There is also a link in the show notes for that. If you want to get access to the videos but can't be there for the live stream, that's okay. You'll get the videos if you grab your pass over at selfreliancefestival.com. Finally, if you have a question or want to give me feedback, send me an email, Nicole at livingfreeintennessee.com, Nicole at livingfreeintennessee.com, or head on over to livingfreeintennessee.com and click on the contact form. I've been getting a lot of questions over social media text messages, and those are like farts in the wind to me. I try to answer them when I see them. Sometimes I don't see them. Like Facebook in particular doesn't give me notices till weeks later sometimes. And if it's a hard question that requires follow-up, like I think somebody said something about wanting a digital pass who bought a Self-Reliance Festival in-person pass and now can't come, which I'm totally happy to upgrade them to. If they don't email me, it's not happening because I need to be at the computer to get that done. And I will see notices for social networks on my phone, and then it's gone and it's marked as red. And there's, I'm not always by my computer, especially this close to an event. I am off like shopping for supplies, driving places, getting things, all of it. So definitely, if you want an answer, you're more likely to get one if you send me an email. Finally, the live stream schedule for this week is as follows. I'm live right now. That's what it is. And for the rest of the week, we do not have live streams scheduled. I do have shows coming out this week that are interview shows that are previously recorded. And that's just to keep things going for y'all who are not going to be at Self-Reliance Festival. But the actual live streams I cut off this week so that we can do the best we can do in order to have people who are at the Self-Reliance Festival have the best experience possible. With that, it's time for our first usual Monday segment, and that's Tales from the Prepper Pantry. This is where we talk about using what you store and storing what you use. And somebody sent me an article this weekend saying the title of it was "Having an Organized Pantry is Racist." And stupid me, I clicked on it, and it was like a pretty poorly written article rant about some professor at some university that does not matter saying that having an organized pantry is racist. That was spun a little bit out of context, but still, if having an organized pantry is racist, having that opinion is classist. That is my opinion about that whole thing. I was like, that's ridiculous. Anyway, but we live in clown world, guys, sometimes, and it's funny when people send me stuff like that. I've mostly been cooking since March 1st or so, straight out of canned goods and the freezer by dumping things in the crock pot and hitting go, unless it's a low acid food. When it's a low acid food, I boil it first, then I dump it in the crock pot. And that's because my kitchen's been ripped up. And I never realized, and like, I always appreciate having a functional kitchen. I didn't realize how much I like my functional kitchen until I've gone through this 3-week period of time without one. It's only 3 weeks, right? Of my whole life. I've had other times without kitchens, but 3 weeks. And the chaos around me is astounding, first of all. Secondly, my outdoor kitchen is overrun with building supplies, so it's really hard to function there. Plus, it's now 19 degrees outside, so the water that I would usually have to out there is not on, which leads to a whole thing where I have to carry bus trays of dishes around. I dropped one this weekend and broke a bunch of my dishes. Yeah. So the result has been pretty much every meal that's not takeout is stew here. And yesterday we finally got to the point where my stove is back in place in my kitchen and I can cook on it inside where it's not freezing cold. The Blackstone's great, right? And you can cook stuff on it, but there's just a limit to what you can do. And I cooked a meal on my stove yesterday, and it was like dinner took way less time to cook. It was like flavors we haven't had in a long time. It was delicious. I'm going to go do a scramble with taco meat left over today for breakfast, lunch, and I'm actually super stoked about that. That said, cooking straight from jars in the crock pot or on a stovetop or a pressure cooker with whatever spices I can find isn't that bad. The food was good. It was nutritious. And it was fairly easy to do when I think about it. Like, you just pour it in and go. And, green beans that have been canned are a different mouthfeel than al dente, which people like, but whatever. It totally worked. And it was better than, eating a whole bunch of crap that I just have, right, from the store or from restaurants. We did eat some restaurant meals, though, a goodly number of them, as a matter of fact, during this 3-week period of time. The late freeze has beat back some of the early spring greens that I would usually be eating right now. That's okay. By the time I get back from Self-Reliance Festival, they will have reappeared, and I will see what in my food forest that was put in last fall was completely annihilated by this latest freeze. This is the way the weather goes in Tennessee, though. Like, we have spring, and then we have winter 1 or winter 2, and then we have spring, and then we have winter 3, and then we have spring, and then we have winter 4. So I kind of expect one last freeze in April, because that's the way this year's been going. And it was an extra brutal year for new plants. So I'm also expecting some of the stuff I put in my food forest in fall, even though the timing was perfect for the installation and we were very careful with how we mulched and planted. I expect some losses, and I will fill those in this spring with things I think would go in that place. So far, none of my trees have died. The banana tree might be on probation, though, because it was starting to think maybe it should grow back. I have it mulched several feet up the stem, so I may take that out after the next, after this freeze is done, which is like tonight's the last night of it, which is perfect for Self-Reliance Festival, right? So we're probably going to get some rain at Self-Reliance Festival, but at least it's not going to be super balls ass cold. That's all I can say. So camping won't be totally miserable. It might be wet, though, on Friday, guys. It might be wet on Friday. I'm hoping that they have some rain in the forecast for Saturday, Sunday. I'm hoping that sort of dissipates. Like, sometimes that just disappears. Otherwise, we are as set up as we can be to deal with rain. And people who want to build resilience in their life need to know to bring a raincoat to an outdoor event. Just saying. Although somebody with a good business mind could totally just buy a bunch of those dollar ponchos at the Dollar Tree or $1.25 tree and resell them for $3 and probably make a little bit of money. I'm also doing a pantry purge. As a result of having all the chaos in my life and everything everywhere, I also have become aware that it is time, since I have changed how I eat and how much comes off my homestead in the last few years, to go through whatever's left in the pantry, like cooking oils I don't use, and get rid of them. I keep some for dealing with ear mites and the rabbits, but I don't need to have all this cooking oil going rancid here. And that's sort of been the last frontier. I don't know what else is in there. I also have beans and rice stored sort of as I can give this to people if they need food when we have food shortages. And I say when because that happens from time to time, but not like we're going to have food shortages next week. We might, whatever. But keeping a lot of that on hand keeps me from keeping things I want to eat on hand. So I will be making some decisions and then making space for stuff that I want here. I also have, because we had to pull apart the mudroom, we're going to change how jars are done, how like mason jars are stored on the homestead. But that's for another time. I'll totally, I'm kind of excited. I had this idea the other day when I was standing in the mudroom, like, this is what I can do here. It'll make the room more functional now that it's all ripped apart and rebuilt. So that'll be kind of cool. Next up, we have the frugality tip. And this one comes from Margot. Do you have a Ross near you? Is there one in your travels? Stop in. Things like sneakers on clearance are great buys. Camp chairs are half Walmart prices. Name brand garden tools are crazy cheap. My little secret is to check the food section, where I buy pink Himalayan salt for $4.99 for a 5-pound bag. They have rock and ground. You can get some really good buys in the spice section. Happy hunting. And that's true for home goods. So I do that once or twice a year. I'll go to the home goods store and look in the food section. One time that I like to do that is sort of that pre-Thanksgiving, pre-Christmas time, because they'll have like truffle mushrooms and stuff at really great prices. And I'll get a few sort of special treats for the holiday, or or I'll fill up on balsamic vinegars I can't find anywhere else. They'll have a bunch of imported stuff at decent prices. So that's a really good frugality tip if you like sort of the more gourmet food additive sorts of things. Next segment is Operation Independence, where we talk about building local ongoing revenue into the homestead, as well as just taking control of our financial lives. And this one was originally motivated by me starting to do more things for myself so I didn't have to pay a guy, so I didn't have to earn 33% more money than I actually paid the guy, because once you earn money, you pay taxes on it and then you pay the guy. So like if you hire somebody for $100, it's like $130 that you have to earn to pay the, like it was that whole thing. And we started this gamification of that, and it got pretty fun. Like I was giving myself $1 or $2 every load of laundry I hung dry instead of put in the dryer. Now I hardly ever use the dryer. So I taught myself with this method new habits of smart frugality at home. So what I mean by that is sometimes it takes you so much time to save $1 that you should just pay the $1. Other times, if it works into your whole method of maintaining the homestead or your home, you can actually cut down on expenses just by developing really great habits. And a habit I decided works for me is that I do laundry and then I hang laundry. And in the wintertime, I put my laundry dryer by the wood stove. And in the summer, I'll throw it out. And then there's this period of time every year in Tennessee where it's super humid outside and things don't dry very well. And I use the dryer during that time. As a result, my clothes last longer too, because they don't get so beat up in the dryer. And I use less propane because I dry clothes with propane when I'm not drying them with the sun. So for me, it works. Not for everybody, though. I think about people who have a commute to work and back every day and how that totally changes the math on how running a homestead is. You can still do it, but you're probably going to change if you hang clothes or not. You may not. I mean, that may fit into your life still. You're going to change how you cook. You're going to change how you set up your gardens. And that's important to know going in. Well, this week, the kitchen redo is top of my mind from an Operation Independence standpoint for 2 reasons. One, I haven't done a member webinar in a while, and those of you who are in my membership are probably pissed off at me, and I should send you an email about this. We're going to start doing a lot more webinars once that kitchen's back together, particularly going into the canning, preservation, and gardening part of our year. I'm going to show you how to cure meats, all sorts of different cool stuff from that kitchen once it's back together. The second thing is the kitchen is back together enough I can cook in it again, which means a bad habit I was starting to fall into the last 3 weeks of getting takeout once or twice a week is going away again. And then I'm not spending, $50 on a meal that I could cook at home for $5 or less. Right. So that's pretty cool. And the other thing is today I had a piece of real estate in Colorado that I thought I was going to build on, and it was going to be a second sort of location where my sister and I owned it together, and we would bring our kids together and hang out in summers and blah, blah, blah. And the cousins would get to know each other there. Problem with that is I never got pregnant. So, that was a great dream, but I don't have any kids. And also life took turns that landed me living here, and she's in California, and we never built it. And we bought it shortly before the 2008 real estate crash, and it lost a lot of value. And we've just hung on to it because it was like hardly worth selling. Property taxes on it weren't very much because, when your property's not worth much, you don't get tax much on it. Well, it has recovered a lot of value, not all the value. And we decided to see if we could sell it. Well, it closed today. As a result of that, there is going to be some more debt payoff for me. And at this point, I don't have revolving consumer debt. And I have completely purged that habit from my life and changed my financial situation, which, guys, you can do. I was around between $40,000 and $50,000 in revolving debt when I started this project of not having debt. And that's all gone. And that was all gone after dropping my salary in more than half. I went for 25% of what my salary was when I changed my lifestyle to a homesteading lifestyle. And since then, I earned more money, right? But that first year was pretty bleak. but I still paid off debt because I changed habits and because I could do stuff at home. And I'm telling you this because if you're looking at your debt going, holy cow, what do I do? You can do it. Step one is go listen to the free audiobook, Richest Man in Babylon. It's on YouTube. And just listen to it, and listen to it more than one time if you need to stay motivated. I listen to that every 1 or 2 years to remind myself what I'm doing here. And take the steps you can take one step at a time, and look at what your real situation is. That's hard. It's hard to look that ugly debt beast in the face. But today, I'm paying off the second mortgage on my house because that piece of land, which was a terrible investment, and you may think like, I don't have that kind of investment. That's fine. It's something that happened that I was able to do by taking out a second mortgage on the house, right? And because I already had a house, and I'm paying off that second mortgage again. So it's kind of a net zero, but that second mortgage for me is on a variable interest rate, and interest rates are going up right now. So I was about to be in a bad place with that. And it was about to start feeling like consumer debt to have this second mortgage. And I was unable to lock it. And so that's a huge, that amount of money that goes out every month for that second mortgage is erased from my monthly budget, right? And I only have the one mortgage left on this house. And that will be paid off in 2024. So I'm kind of celebrating because I had one other thing happen to me one time where I was able to sell a piece of property that I had acquired, because you guys know I'm a real estate person, and it had increased in value. So like I went into debt to get it, but it increased in value. I was going to sell it. I was going to have like this payday of $20,000 that could have been used to pay off this mortgage or debt. And instead I used it for other things. And as a result of that, I still had a bunch of debt that I didn't need to have. And the other things are meaningless today, a decade later. So I feel like every time I've ever tried to pay off debt in my life before I learned to just look at the problem, save money every month, even though I'm also paying off debt, because I always fell into this trap that I'll pay off the debt faster if I don't save money. So I save 10% no matter what now. And then once or twice a year, I decide where that goes. And where it has gone is to help me pay off debt, right? But I've also kept a good chunk so that when emergencies happen, like more than the $1,000 emergency fund, I'm not completely screwed. So, and that's been important to stability. So developing that habit has been instrumental in getting to this point where the universe once again gave me this opportunity where a piece of real estate from my life was going to get liquidated, and I could use it to finish my kitchen really nice, or I could use it to pay off debt. And I'm using it to pay off debt. And my kitchen will look fine, but it will not look really nice, and it is not finished for what I want it long term. And that's fine because it will be functional, and I'm not going into more debt over that project. Okay. That all sets the foundation for the main topic of today's show, which is how can we fund medical care in our communities? I'm going to remind you, because a lot of people have joined the live stream. Hello, Martinson family, Chuck, Northeastern Missouri, Hunter, Martison is here, and Tree Walker. You guys have commented. There's a bunch more of you in there. If you have questions or comments as we get into this topic, try to put them in all caps, because these eyes are not... I was actually at the emergency room last night, so I didn't get a lot of sleep. Don't worry, nobody's dead. Nobody's hurt. It was a false alarm. Chuck, we're blaming you. But I only got about 4 hours of sleep last night. So I really can't see what you're saying if you don't say it in all caps very well. I can see your names. But I'm feeling a little blurry today. Blurry and bleary. How can we fund medical care in our communities? This came up because I interviewed a direct care provider in Knoxville. Direct care, it's also called concierge medicine, is a subscription-based service where you pay, let's say, $100, $200 a month. I don't know what the price is. And it was tactical, Chuck. It was 100% tactical, but he'll be at SRF and he does not have stitches. That's all I'm saying. And he also says it's totally your fault because you brought it up. Anyway, direct primary care subscription. And what this does for the doctor is they have predictability of where their money's coming from and how much is coming in. They also get to plan out extra time to actually help treat their patient and come up with preventative measures. So it's not just strep test, here's your antibiotic necessarily. Depends on your doctor, right? And what it does for the patient is he promises same day he can fit you in one way or another in exchange for your subscription. So a lot of people will pair that with a catastrophic plan or with a health share and come out like every month less than just buying health insurance right now and getting a better quality of care from the doctor. Now, if you get cancer, that's not what a direct primary care doctor does, right? So you're going to specialists at that point, and that's why you have that second little insurance package. That's like the trick people are doing now. Well, finding a direct primary care doctor is really hard. But while we were on there, he was like, I don't think emergency services should cost any money. We should just tax everybody, pay for that, and it's all free if you have to go to the emergency room because, and then you pair that with direct primary care, and then you don't get that nasty $20,000 insurance bill or emergency room bill for stitches. Or like at my regional hospital, which is very small, it's like $4,500 to get 4 stitches. That's like $1,000 a stitch. Anybody who's put a stitch in understands how absurd that is. Now, the direct primary care doctor says he will just do stitches in his office because he can. And that's pretty much the only alternative I have found to getting stitches when you need stitches at this point in how our medical system is. So you either pay out the nose for it. And this is like legitimate critiques of our medical system. This is the problem, right? The problem is for stupid things like stitches, we are billing insurance and or charging people to, $4,000 for 4 stitches. That's some lidocaine, which probably costs 45 cents, and stitching. That's completely absurd. It's completely absurd. And there's no go to the urgent care. It's very rare to find an urgent care center that does stitches. In fact, ours here, if you go there needing stitches, they're like, go to the emergency room. You need stitches. We don't do that here. What the urgent care does in my community is test you for the flu, strep, COVID, all of those things, and then gives you antibiotics, or looks at your rash and says, yep, that's poison ivy. Misdiagnosed me with shingles that time, guys, and gives you a prescription for a steroid cream that doesn't work because, as it turns out, when you have shingles, steroid creams don't actually work, right? Yeah. Medical coder in my comment says, don't go to the ER if you can avoid it. But the problem is there's no middle ground. There's wait 70 weeks to go see your doctor, or there is emergency room and urgent care is not filling that gap. That's one problem. Another problem is that the way our medical system has developed over the last 80 years, in part as a result of the federal government putting a program in place to backstop poor people to try to get them care, and the resulting bureaucracy and coding setup that was put in place for that to help, quote unquote, control price, has led to a situation where the government can be lobbied for price or to say cover this drug and not that drug. And that system has been adopted as how normal billing is done because most people have insurance now. And it has caused major price inflation. And this can be illustrated in the following example of a CT scan. A friend of mine needed a CT scan, did not have insurance. This was before insurance, the whole insurance required thing. And it cost $450 to get the CT scan, and he paid it, took his results to a specialist. They did what they needed to do. A year later, he had insurance, and he needed another CT scan follow-up. That CT scan cost him $1,500 out of pocket with insurance. And when he asked, what if I just pay cash? They said it's $450 if you pay cash. Okay, well, I'll do it directly. They're like, no, it's fraud if we don't bill your insurance. So he's actually paying more than 3 times the price because the negotiated rate at his insurance company is thousands of dollars. His copay is $1,500. And the justification for that is that they negotiated that rate based on some formula in Medicaid of, Medicaid base plus whatever. And as a result, it has basically nothing to do with what they actually need to charge. Now, I've talked to doctors' offices about this, and I've gotten 2 stories. One story is we have to make the money through the insurance to pay for not making enough money on the cash customer. That's been the one story. And if that's the case, you need to fire whoever runs your office and do business like a business person. Okay? Because that's absurd. That's an absurd model. That's not sustainable. 2, the other story I've gotten is it costs us so much in overhead to bill insurance that we need to get more money because we will send the codes in, and we've got a coder here who's probably seen this happen. We send the bill in, they deny it out of the chute. Then we send it a second time, and then sometimes so they have to fight for their money, and they'll be backlog 6 to 9 months on getting paid from the insurance. That's a lot. And they have to pay the coder, and they have to pay people following up. All of that is overhead that has to be handled. So the cash price is so much cheaper because when we give you a bill, you pay it and it's done. Now, armed with this information, I have spent most of my life paying cash for medical services, which can be frustrating. And here's why. Many offices are set up to deal with insurance, and that is all they're set up to do. So when you ask a question, how much is this? They have no idea what to tell you because every single little plan in every single little insurance company, different types of plans will have different rates. So they don't know until they sell it to you, send the codes to your insurance company denies it. And then after they deny it, the second time they say, well, this is how much you can really charge based on whatever contractual agreement we have with whatever network you're in. Oh, wait, you're out of network. Now you're screwed. Okay, that whole system is a big part of the problem, but it's not the only problem. But that whole system is messed up. And so when I lived in Oregon, I needed OBGYN care, like many women do, right? You want to stay healthy. And I had to get tests done for an immune system disorder that I have, it turns out. And they had to take a biopsy for it, and they did. And I was like, okay, I'm ready to pay. How much is it? Office manager comes out like, we don't know till we bill your insurance. And I did have catastrophic insurance at that point. It was before Obamacare ruined that whole game, where you have a catastrophic plan with a high deductible, and then you put money in an HSA and then use that to pay your bills with. It was great. And I said, okay, well, if I pay cash now, how much is it? And she's like, I don't know. And so they didn't know what to do with me. And then when they finally had a price, I was like, but if I pay cash now, how much? And they gave me a 25% discount. I don't even know if this is possible anymore in some places. Like somebody said that's fraud now. I don't know if it really is. But just your mileage may vary on this one. And so I developed this habit every time there was a problem of saying, if I pay cash right now, how much? And most of the time I got 25 to 50% off the original price without even trying. And that's because in many instances, actually cash paid right then costs them so much less in overhead that they make money. This is why doctors are waking up and doing things like direct primary care on subscription for cash. They will give you what's called a super bill, and you can bill your own insurance with that. And everybody wins, right? This is how health shares actually stay healthy. Is you pay for service and then it gets reimbursed and it's dumb. Yeah, the person who does medical coding says yes, it's terrible. It's terrible. It's also a whole industry of you can learn how to do medical coding and make money doing medical coding, by the way. The other problem is we have taught our population to conflate health insurance with health care. And I first noticed this problem when I met somebody on TennCare, like he was a teenage kid, 16, who had all sorts of tooth problems, right? And he said, I can't get my cavities filled because TennCare doesn't cover it. And I asked, this is somebody I was paying to do work on my homestead, by the way. I asked, how much is it to get your teeth fixed? And he was like, $250. How much are you making today? And it was like he'd never thought you could just pay the dentist to do your cavities. Because his construct was that you get sick, you go to the doctor, you use TennCare, it pays for everything, right? And if your TennCare lapses, then you can't go to the doctor because the doctor will be way too expensive. And then he had applied that to dental care. And at that time, if you bought dental insurance, it cost more every year out of pocket to have the insurance than even if the worst thing happened to you to get it handled. And so there was no point in having dental insurance. It was like worst catastrophic situation happens in my mouth, and the cumulative amount of all of my premiums is less than what's happening for what's covered in my mouth, plus what will be out of pocket to handle it up to the limit where they stop covering it, and then I have to pay more cash. This is why I've never had dental insurance. This is actually part of the source of my dental problems. Is the clinic I was going to this year has completely transformed over to Medicaid dental, and their whole system is set up to handle that, and they can't handle cash anymore, really. It's like, it's way more out of pocket. I'm looking for a different dentist who's just able to take cash at this point, long term, because I don't want to go through their bloated system and go through all of the different steps of people finally get care. That's what gets set up, right? Big bureaucracy. So people conflating insurance with care is a problem. And at this point, it has resulted in this I can't. It's giving them limiting beliefs. I can't go get myself screened for this painful breathing problem I have because I don't have insurance for that. Or I've already maxed out my insurance for the year, or I don't have enough money for my copay or my deductible. It's really high. So I can't. I can't go get screened for cancer because if I'm diagnosed with cancer right now in between insurance policies, it won't be covered. Right? You heard that one. That's part of the motivation for Obamacare to begin with, was pre-existing conditions weren't covered and people were going from insurance policy to policy to policy because they're conflating the insurance policy with the care they get. Don't get me wrong, these things caused problems, right? But it led to a limiting belief of there's no way to do it any other way. And so now when people are like, hey, I lost my job, I have to do everything I can not to lose my insurance because I'm screwed if I lose my insurance. So then they pay Cobra, which is super expensive, thousands of dollars a month sometimes. But I'm not going to survive if I don't have insurance. What if the one terrible thing happens, without just bothering to look around and saying, okay, I'm healthy. I don't have any weird pre-existing conditions, and there are other ways to do this. Health share, for example, is one option. Emergency policy, less than Cobra, also possible. Those high deductible policies are back, also possible. But that limiting belief of I can't without insurance gets in the way of a couple of things. One, it gets in the way of people taking financial ownership for their lives and for their healthcare. It also is part of the source of bankrupting people who get sick. It also makes people delay important things for their health in light of waiting for it to get paid for by insurance, causing bigger problems. And this, in turn, taxes our healthcare system, right? Another problem we have is the way the regulators interact with the medical system. So, Republicans put in place that you have to give care no matter what the financial state of the person is, right? And then, as a result, hospitals were losing money, and then the government's supposed to give them money for the people who can't afford to pay. That was the original idea. That got out of control, and then hospitals were screaming, and then Obamacare got put in place to force people to buy insurance so that situation doesn't happen, right? I see a question 30-day reviews, so I can't really tell what it is, so put at least copy paste that and put some of those in uppercase so I can see it. We also have something called certificate of need in Tennessee. This is not true in every state, but in many states you have this. Certificate of need requires a hospital that wants to have emergency room beds, for example, to prove that they are needed, because the underlying thought is if we allow any emergency room to exist anywhere, there's not enough guaranteed business to keep the hospital open, and you'll have more hospital closures. As a result of that, you don't get beds in rural communities because they can't prove the need. And so your emergency room might be an extra hour drive sometimes, or whatever specialty you need. They do this for screening equipment, for NICU, for all of it. And the people making the decision on the board to review if the need is really there are your competitors. The more you dig into what the problem is with healthcare in our country, the messier it gets. And there is a big problem with the private businesses and nonprofit hospitals are in bed with the government through lobbyists to make them more money, including the nonprofit hospitals. Yes. Yes. They are not it will cost more to get a knee replacement at a nonprofit hospital than the surgery center in Oklahoma, which does it for cash. Because they're part of the problem. And that construct for them has been put into place to make people lots of money and to make sure everybody pays for their health care. And it's been set up with the force of government through taxation, through a whole bunch of other regulatory things, even intellectual property rights on the pharmaceutical side, to our current sick system, which is not all that different than our current sick taxation system through the IRS, guys. It's complicated. And I think because explaining the problem is so complicated, we end up with people giving up, blaming the insurance companies, blaming the doctors, blaming the pharmaceutical companies, whoever they feel like blaming. And they throw their hands up because it's like, well, okay, we fixed that, but it didn't fix the problem. Of course it didn't fix the problem. The problem is the entire system is unnecessarily bloated and bureaucratic and fascist, basically. It's basically fascist. People say it's socialized. It's more fascist than socialized. But those things are not that far from each other. So that begs the question, what is healthcare and what is health? So we need our medical system to help us when we have problems. Like the problem we had yesterday, where an x-ray was required. I don't know about you, but I don't have an x-ray machine in my house. And it was an urgent enough x-ray that we went to the emergency room for it. But that's when you have a problem. What is health? There was a time when we saw doctors as health coaches. So they helped us troubleshoot or deal with problems and also talk to us about our lifestyle choices that might be negatively impacting our health. Okay. And that's a very different thing. The question is, what is health and healthcare? I want to be able to go get healthcare when I need it. If I break a finger, I want to be able to get that splinted up and whatever I need. I want pain medication when I have nerve pain in my mouth. Not that that was even possible in Tennessee because they're so defensive about pill poppers that they didn't want to give me one that would work. But that is what I want, right? What I really wanted when I had this was to get the surgery done that I needed to have done on my face, so I didn't need the medication. But instead, we just keep medicating, right? It's the easy button is what we want. Healthcare to me is trying to help us get to the underlying problem and fix it. And I understand sometimes you just can't. Some people are just gonna get sick and we can't help them. And we try and we make them more comfortable and we do our best. But there's a certain element of we all have this fatal disease called life. And health to me is getting up every day and feeling good and being able to go on a walk and being conscious about what I put into my body and working towards having a healthy life. And we've divorced these things from each other. There's like gym memberships over here, nutrition over there. That's a whole like cluster of debate. And then the healthcare system over here, and these three industries don't talk to each other. They're all siloed. And yet, getting out, getting active, doing what I do here, growing food is part of the solution. And that may seem like a far stretch, but if you don't get sick, or you get sick less often, you're in a much better place than if you're at the doctor every other day. But how does that mentality, how does going back to a healthcare mindset instead of a health insurance mindset, which is just like, hey, let's make a profit off sick people. Hey, by the way, I'm not anti-profit. But it is sick how we have made it more motivational to keep people sick than to get them healthy. That doesn't mean your doctor doesn't want you healthy, guys. But if the system's set up that way, that's hard to fight against. Kind of like how our government works. It's set up to grow. It's very hard to fight against that. How do we then get medical innovations if we don't have a mindset of what actual health is? And I think that most of the innovation that's happened, separate from the horrific tests that were done in Nazi Germany that actually led to a lot of knowledge in the healthcare industry, I think they happen when we're out of the way of people finding innovations. That is my philosophy. If we separate lobbying from healthcare and separate the expectation that the government somehow has to pay for us to have innovation in healthcare, bet we'd get more innovation in healthcare. I bet we would. And I bet we'd find some pretty simple cures for things or ways to make things better. And I look at herbal medicine for this one, where I had a cold last week. It sucked. It was 7 days of suck. And I was able to function and I, semi-function. I was able to get the podcasts out. Part of why is that there's a plant that grows in my yard that I made tea out of before I recorded every podcast that got me through the podcast before all the voice stuff started happening again. It's mullein. That worked for me. I had another friend who has a cold who I heard she had a cold and I said, hey, I just had a cold with remarkably similar symptoms to your symptoms. And I will tell you that mullein worked in combination with mint pretty well. It didn't fix it, but it made me feel better. Okay. Well, that innovation's not sexy to research at all, because how do you make money on a plant that grows wild in a ditch? You can actually. If somebody made mullein tea bags, I bet you'd be able to sell them. Just saying. But the lobbyists in part being involved with the force of government who's taxing you to provide the care helps set what the options are when you get sick. And that's a problem. Another thing that I think can really help medical is return to cash and trade. Cash for service. A lot of people go into the medical business, doctors, nurses, because they want to help people. I know. Some of them probably do go in because they want to make a lot of money. Most people I've ever talked to in the healthcare industry, though, are actually interested in helping troubleshoot problems that people have with their health and make them better. Call me crazy, but what if I just paid you for that? Hey, I need a coach right now because I can't talk. I don't know why. Oh, I can give you money and you can help me. Cool. Right? So, it's amazing how that is just a simple interaction, and we've made that almost impossible to do in our current system. It's like mind-boggling how hard we have made this. I'm sick, you help me deal with it, and I give you money, or I give you eggs, or I give you coffee, right? Doesn't even have to be money. That's up to the doctor. And the doctors are like, I don't want to deal with the money because I want to focus on the people. Yeah. That subscription model, by the way, it's great. You could do subscription models in so many things, and they could be great. Now, let's think about outside of our box. How could we provide community healthcare? And I think about the Amish on this one. How do the Amish get healthcare? It is my understanding that when somebody in an Amish community is sick, that the community comes together to help them with the financial part, if it requires going to a doctor. The flip side of that is when somebody gets sick in the Amish community, it is my understanding, I've not verified this, if they're very expensive sick, they may choose to pass on rather than be a burden on the community. So that's like a community supported situation. Guys, this is kind of the health share model that already exists, right? You join a health share. It's a faith-based exemption to Obamacare. You pay monthly to pay for other people's needs. And when you have a need, you put in a request for that need. And the community supports it. The doctors are getting paid cash in this model. And the community can say, we're not supporting your need. We can become realistic about care. There are like, we can do so many interventions that it's nuts. And one of the big challenges, I think, in the healthcare debate is that we all want our loved ones not to die. And our loved ones are going to die, or we're going to die. Somebody's going to die first. And so we will do anything, and we will make any sacrifice possible to help our loved ones. And that is good to an extent, right? But if we don't become realistic about the fact that we are going to die and what that means from a care standpoint, I think we further this situation of I will pay anything and indebt myself and my children for the rest of their lives. And I think that's a hard discussion to have. Like, when should you be getting care and when not? And then we need to stop supporting having a banker or IRS mentality in health services billing. And what I mean by that is that whole coding system that's in place, which office managers at health care providers cannot even fathom doing without. That whole thing is a big part of the problem. And it's bringing in an overcomplication like the IRS does to our taxes, right? Or, also the government has put regulations on that. Also, government has put regulations on the medical system, right? So they're very similar. Bringing that mentality into health service billing, unless we get rid of that, the US stops innovating. we're already slowed down on innovating. Other countries are going to bypass us from an intellectual standpoint because we are so sick in our healthcare system is so sick. So then how do we pay for it if Tactical needs to go to the emergency room and we don't want them to have to pay out of pocket? Well, if we have made the emergency room cost more what it should cost, which means people are getting reasonable money for being there and people are paying reasonable money for going there, Tactical might be able to afford his emergency room visit. When I was a kid, it was like $400 to go to the emergency room for something. Now, that didn't mean I went to, and our attitude about the emergency room is you better really need it to go. It wasn't just like, hey, I'm going to go because I have a sniffle, right? I think a big thing that would help is transparency in pricing and getting costs under control. If you know how much it costs, you can decide, am I waiting till tomorrow morning or not? Like, am I that sick or hurt? So there has been a big fight in transparency of pricing in the medical complex, because what will become apparent if they have to publish their price or their rate sheets is either it's really super obnoxious what they're publishing, like hotels do. Our room rate is, $40,000 a night, but you can have the room for $69.99, and then they never get in trouble. It'll either be that, or it will become very obvious that there's a vast variance in pricing that makes no sense. And in areas where people publish their prices, because we have a whole free market thing going on in healthcare where voluntarily clinics are publishing their prices. This is the price. This is the same price. And whatever your insurance says, this is still the price. And if they don't cover it, you pay the price. So here's the price, right? In areas where that happens, prices come under control and the clinics make more money, because it takes that fear factor out. When it's going to be $89 to see a nurse practitioner and $189 to see a doctor. Okay, I'll go see the nurse practitioner because I just need a tetanus shot, man. I don't need a doctor for that. I just need the shot or whatever it is. Getting the regulators out of the way would be huge. The certificate of need is preposterous. I think the HOA model can really help with community funding, and by which I mean you move to a community and you opt in. I would love it voluntarily, but if it's part of your land deed, then you knew before you bought the land, whatever. We can argue about that you pay $100 every month into providing emergency services to people in the community. Done. You join a church, they may have, it could be the same thing. That church is like, you tithe to this amount and we pay for medical for people. Join a health share, same thing. That can fund a lot. And you can have it set up so that if you don't voluntarily join and you need it, you pay a bigger bill, which is encouragement to just do it. Patrons, guys. There have always been patrons in innovation. And that's people who already have money pay for it. People who already have money and a desire to help community health are like, you know what? I'm going to support this ER for $100,000 a year. That just helps pay for the doctor's salary or whatever. And then I really think the health share model is something that people are just terrified of because it may not cover everything. Well, in their documentation, when you sign a contract, they say what they don't cover. B, they have max lifetime out of pocket. You know what your health insurance also has? Max lifetime out of pocket. The biggest critique I have from people from the health share issue is that they may be diabetic or something. So they have a pre-existing condition, and a health share community can say, here's the deal. You can join, but anything that has to do with your diabetes is not a shared expense. You should be making enough money to pay for your diabetes now that you know you have it. So they can exempt things, and they can say, actually, you're not a good fit for us. Like if you weigh too much, your BMI is too high, they won't take you on. And And that kind of makes sense, especially when you're joining the community. They're like, these are our standards. Live up to the standards. A lot of them say, you can't smoke. A lot of them you can't smoke. Because you know why? Because like smoking and lung cancer kind of go hand in hand. So those are just some of my ideas of ways to pay for community health. And that's really like transparency in pricing, regulation reduction or elimination, having an HOA model, having patrons, or having a subscription service. So all of this goes back to we pay for it. But guys, we already pay for it. Wouldn't you rather pay for it in a way that does more good for everybody? I think so. So the problem I'm solving is not how do we replace the government? The problem I'm actually solving is how do we make healthcare work again? And I think a big way to do that is stop this overly complicated dependency on bureaucracy to provide shitty service for people or no service for people, and start thinking, how can we get care here? And it's kind of like what Uber did to the taxis. I feel like we can replace the system before they know what happened. But wouldn't rural communities suffer if we did it this way? Because they wouldn't have a subsidized hospital? Maybe. Maybe that's the trade-off you make for being extremely rural, is you have to go further for health care. You have to get a helicopter for your community to fly people places. I don't know. It's, I've been watching Yellowstone, and they go to the vet who takes care of people sometimes in that show. And it's like, well, I could see that happening because the vets actually have a fair amount of medical knowledge, guys. But we also have a prohibitive system for doctors even becoming doctors. So that's a whole thing I didn't even bring up. Those are my ideas today. I would love to know, how would you fund things if taxes were not an option for healthcare? Let me know. With that, if you like the show and want to support the work I'm doing here, you can do it in two ways. One, get your coffee at hollowroast.com. Two, consider becoming a member. Information on that is over at Living Free in Tennessee. With that, guys, go out, make it a great week. I can almost always tell how many of you watching have watched before, because I do the 5-second pause and then I go to the Q&A. And if I don't see the number go down, I know, it's all people who actually already have watched one before. So 30-day review says, what happened to the redneck now? All I can say is only the redneck can tell that story because it's his story to tell. But he's fine. But we did go for a late night drive last night to the hospital. And Chuck, it's your fault. Chuck says, modern healthcare has us fooled and programmed, or has fooled and programmed society so that it's so technical and requires a specialist and meds. It's not rocket science. There are things complicated about us medically. And I think one of the things that we don't fully embrace is that a lot of times the doctors are also making an educated guess on how to help us. And so then we get frustrated when it doesn't work. It's like, you were supposed to heal me and you didn't. Well, they're making an educated guess based on statistics of what they've learned. And they're like, try this and see how it goes. Okay, try that and see how it goes. Okay, we've ruled out that. Okay, now try this other thing and see how it goes. Oh, you didn't tell me about that symptom. Try. So there's some amount of they don't know. Sometimes it's very obvious. Broken arm needs to be set, put in a cast and heal, and then rehab. Some things are easy. Some things are not easy. Stitches are easy. Some stitches are not easy. Depends on how deep the wound is and where it is, right? So that's what it is. Okay. Legalize in-home doctors. You know what? They are legal in Tennessee, because the guy I had on my show, by the way, thank you for the $5 super chat. In-home, that concierge guy I had, he said, I do house calls. Well, think about this. How much less do we spread viruses if instead of going and sitting in the waiting room at the doctor's to get seen, they come to us? Now, they could be the carrier in that situation, but how many fewer people would get exposed to stuff? Just throwing that out there. In-home is, and I've had COVID a couple times, and the last thing I was going to do was jump in the car and go somewhere feeling like that. I was like, I'm going to stay in my bed and be warm. and drink tea and take baths. I took like 90 baths a day or something. 30-day review says, I think sometimes people are selfish. If they know who's getting it, they will complain. Where attacks, you never know where it goes because, yeah, maybe. But, you know, like setting up a system because some people are mean doesn't solve the problem. Most people are not mean. Some people are mean. And then in desperate situations, more of us become mean because we're going to look out for ourselves and our families first. That's just the way it is. My BFF was a vet tech. She patched me up on occasion. Exactly. So anyway, guys, that's everything in the Q&A. As I mentioned, this is the last live stream till next Tuesday. Monday's show will not happen next week because I'm going to Self-Reliance Festival, and there will be interview shows between now and then. I may bust out the Homestead Happenings actually right when I get back. It depends on if I'm home Monday night and have energy, but usually I'm pretty tired after that. So Tuesday we'll be back. I will do a show on Tuesday. It will not be the John Willis Live that we usually do. We're taking 2 weeks off of those live streams and then coming back first Tuesday in April with Jack Spirko. Second Tuesday is somebody you're not going to be expecting, but it's going to be badass. So thanks for joining today, guys. Make it a great week.